Dr. Chris, you hit the nail by telling us that sleep is our superpower, just as Matthew Walker would say that. I will present today. My name is Dr. Dinoy Lubaton. Christian Angelo is the name, but Dinoy because of Fido Dido, the season when I was born. So I'm here to present the health risk patterns among Filipino seafarers. It's a boring title. Let me challenge the title and telling you that do we have enough healthy seafarers for the future? If you're a seafarer, listen up. If you're a ship, crew manager, training, suppliers, healthcare, listen up. Because we can avert a crisis that is incoming for us. We did a research 5 years ago. We started operating to take care of the pre-employment medical examinations of Filipinos here. And thousands of patients after, we're here to present to you what we have seen so far, even in the middle of the pandemic. It matters that we know the risk profile, the health profile of Filipino seafarers, because our seafarers are our dearest and most valuable asset in the industry. So, from 2018 to 2022, we put together the data. And then we looked at the patterns of behavior and risks identified. We also looked into, for operations purposes, how long does it take from your PMA to the fit to work status? And I tell you now, it's not within 24 hours. It takes, I wish I could say days, but it would take weeks. Again, let's answer what is the health risk profile of a Filipino seafarer. So it's there's a risk classification that we use. Class A, Class B, Class C. This is not an original from us, but this is put together the standards. A, you don't have any problem. B, there are some minor medical issues, could be resolved immediately in a few days, a week. C, it takes more. It takes 2 weeks or more when there is some specialist clearances needed, even some procedures and even surgery needed. And so what risk classification do Filipino seafarers fall into the most? Anybody could guess? Can I see a raise of hands, please, just to give some confidence? If it's A, raise your hand. How I wish. B? How about C? The majority is correct. Listen up. The results are here. It says, it's a total of 11,831 seafarers, the largest study of its kind. I'm happy and so proud for a Filipino company to put it out there. We presented this in the International Maritime Health Forum in Athens, Greece recently, this early October. And I saw how big the study looks like. It hasn't been replicated and it hasn't been anything like it before. And what we saw was 55% of our seafarers, or at least what we've seen is 55% of them are above 40. They're really younger. Secondly, this is a good feedback to the crewing company, which we said for sustainability purposes, and we said, we saw 17 male seafarers compared to 1 female seafarer. A way uphill work we need to do about it. And also, again, married people are not necessarily healthier people. How many are married here? And they are employed with the same maritime industry to put some control. I think I should ask that question. So, the results tell you, I just want to wake up, it's the hardest time to give a talk, right? So, C, Class C is the largest group of seafarers, and only 4% are Class A. 4 out of 100 seafarers are fit to work the very next day. So if you're a crew operator, send them 2 weeks ahead prior to your planned embarkation. Or more. The crew planning should be good. You cannot expect that the PAEPI clinic needs to produce a fit to work certificate immediately if he is not fit to work, or she not fit to work. So, Further discussion tells you there's a high prevalence of high-risk classifications. Throughout the years, it was consistent. Almost half fall into Class C. And Class C also takes a longer time for fit to work. The next level is Class B, also at least a few days to a week for them to be fit to work. It is what it is at this point. And you also need to see in the study, I distilled a little bit here, that the fit to work duration associated with the risk classification, higher age, male gender, longer periods of time. Class A, it takes about 4 days. Class B takes about 13 to 14 days. Class C takes about 18 days or more on the average. So again, this is good for the crew operators here. It takes time. The study of 11,800 plus seafarers tells you that it takes time. Secondly also, here's the profile. If the seafarer is older, male gender, married, and higher ranks exhibited higher proportion of risk class C. And look at the highlighted part. If you are more than 50-year-old as a seafarer, your risk is so much higher. We see rare 50-year-olds who are class C. But we see some, and it's astounding. We're actually learning from them. How do you do it? They stay productive on board, but they also stay happy on board. And the secret is, it's not part of the study, the secret of the healthier, older seafarers, higher ranking officials that we see on board, the secret is happy relationships. It is consistent with the Harvard study on health and happiness for the longest time, for 80 plus years. It's all about relationships, but that's another study we'll pull up next time. Again, male seafarers are on the higher side of risks. It also shows to you, again, higher proportion of Class C. And the married people are also on a higher risk. The data tells you. It's not an opinion. And again, look at this. This is very important. The masters and the chief officers and the higher ranking officials are the less healthy seafarers on board. That poses a problem for me. Number one, they're rare species. It's good. It's not easy to get and retain good captains, chief officers, etc. But secondly, they are the ones with the most influence on board. And they're also that they will also be implementing the healthy behaviors on board as well. If they themselves are not that healthy, we got some work to do with them. So what we do recommend is, well, look at, again, these, as you get older, you see that the chronic diseases, look at your medical repatriation rates, you will always see a lot of non-communicable diseases there getting worse while on board. We need to do something about it. And what we recommend is this: we may consider a more frequent health screening specific to age-related conditions. Some crewing operators even ask us, can you always do 2 years validity? We say, at your own risk, ma'am or sir. Because we tell you, many things happen in 24 months, right? And the problems that we see in telemedicine and when we have calls from seafarers on board, it is preventable as much as possible. If you want to invest in better, more routine, and closer, holistic approach to the healthcare, especially screening of your seafarers. Again, for males, what we've seen, it's cardiometabolic diseases. What are those? Hypertension, diabetes, the liver, and such. It's not new. I'm just telling you, it's confirmed in Filipino language, and it's confirmed. It means it's really right there. And what we're seeing also, we see specific stressors associated with occupational positions. Higher ranking doesn't necessarily mean healthier. We can do something about this. It's time to revisit our health programs for our seafarers. And concluding, well, we see a significant number of seafarers fall into higher risk classifications. Again, we only see Class A 4% only. And higher risk, it takes longer PEME to fit to work duration. So for crew operators, this matters a lot. And you gotta look into the age, sex, marital status, positions, reports. There are things that are modifiable here. There are things that are non-modifiable, especially age. What can we do? 2 things. comprehensive risk assessment, talk to your payment providers, make it very specific to your fleet. A passenger fleet is different to a tanker fleet in terms of screening. It matters, the risk is different, and there must be a comprehensive management. I'm asking us all to start rethinking how we do things. We need to revisit the standards, hello American PNI Club, and everyone here, on proper pre-boarding medical screening of seafarers. Try to consider a holistic, a tailor-fit nature of their role at sea. The type of vessel and voyage makes a lot of difference, and the duration of work at sea as well. I see a lot of people nodding, and I said in my earlier participation, I hope we could put this in our action items. And the medical classification should be included in the evaluation of our seafarers that can influence appropriate vessel assignments, work locations, durations, and role and scope of work. Here's one tip for crew operators here. If you are having a higher ranking seafarer, go for shorter contracts. Why? If you can still do a fit to work for a diabetic, hypertensive, long-term master, a valued officer, that's okay. Let's give them a year or 6 months. Because that person, whether ashore, especially at sea, needs to see their specialist within the next 6 months at least, or even less than 3 months. Even do telemedicine also as much as possible. It's time to revisit short work contract durations. I could see a lot of eyebrows here, but with unique skills with pre-existing multiple medical conditions. Increased frequency of health screenings. We know we're a PAEPI clinic, this is gonna be for a game, but it is a recommendation based on the study. Age-specific, age-related, and again, tailored fit health promotion strategies. What works for you? What could work for you? What are the best practices in the industry with your friends here? Let's talk to one another. Let's open ourselves for collaboration and cooperation. The art of the sailor is to leave nothing to chance. We don't want to leave it to chance, especially with regards to our most valuable asset in our people. Thank you.